Welcome to Eating Disorders Awareness Week. We, team at ACPN, provide care for patients with eating disorder, which is done through multidisciplinary approach, which is the best treatment approach for managing this escalating and growing condition. The team is formed of a psychiatrist, who's myself, who provide assessment, management of psychiatric morbidity and also medication prescribing. I'm lucky to have my colleagues, clinical psychologist, general practitioner, and dietitian who will tell you about their roles.
My role as a clinical psychologist is to work with you on your body image, improve the relationship with food, and we do this from a psychological perspective. We work on alternative coping mechanisms, motivation, and relapse prevention. We do this from an evidence-based but multicultural sensitive perspective.
For me as a general practitioner, the first point of contact, my role is to maintain good physical health to avoid complications and to be sure of maintaining the condition even during and after recovery.
Nutrition plays a crucial role in recovery. My main job basically is to help patients rebuild a better relationship with food and helping them making better choices to guarantee overall well-being. So if you or someone who know is struggling, we're here. Our multidisciplinary team is ready to help. Please reach out. Thank you.